final guest is Congresswoman Robin Kelly, the chair of the Congressional Black Caucus Health Braintrust. She's a vocal advocate to end health disparities for minorities and really everyone. Congresswoman, great to see you today. I don't know if great to see you again. I don't know if you've heard much of our conversation today. We've covered a lot of the different dimensions in two programs and events, looking at, everything from, Medicare, Medicaid, the economic side of reform of this, but then also looking at science and technology and how innovation may be coming to a point where you get a better and broader impact positively of technology. So trying to cover that wing. I know you're very, very focused, and you have been during the COVID crisis, on ending health disparities. Diabetes is part of that picture. Tell us what your dashboard looks like.
Yeah, so first of all, thanks for having me. It's good to be with you. I'm the chair of the Congressional Black Caucus Health Braintrust, plus I'm on Energy and Commerce, the Health Subcommittee, and then the Disparities working group from Energy and Commerce. So we have been looking at what we can do to close the disparities gap. And yes, we talk a lot about Black and brown communities because how they're disproportionately affected by COVID. But we know while those numbers are shocking, they're not surprising because this has been going on forever. If you look at HIV, if you look at diabetes, if you look at addiction, I could go on and on and on. But also I know, because my district is urban, suburban, and rural, that those who live in rural areas also suffer because they just don't have the access. So we have been looking at different pieces of legislation on how to close that gap. I've done a lot of work around telemedicine because I was the ranking Democrat when we were in the minority on the Oversight Technology Committee. So I worked a lot with my actually Republican colleague, Will Hurd. And so I really got into telehealth or telemedicine also to see what we can do to continue that. The rate of using telemedicine just jumped up tremendously. And I'm married to a doctor. So my husband was upstairs doing his work and I was downstairs, and it was really his first exposure to it. So a lot of work around ending disparities, clinical trials, trying to get more Black and brown people involved in clinical trials, work around telemedicine.
Congresswoman, I can't find any member of Congress and virtually anyone out there that's a critic of telehealth right now. But at the same time, for 20 years, I've been talking to my friend Larry Irving about the digital divide, about the fact that, after 2 decades, we still do not have a plan to get both urban areas that are not connected, but also rural areas that are connected. And it just, I just ask, as we all run and embrace telehealth, are we inadvertently creating another divide out there and ignoring the fact that there's still a lot of people that can't take advantage of telehealth? Or are the benefits the benefits of moving that way outweigh the concern that we should have right now for those people who aren't connected?
Well, there's bipartisan and bicameral interest in improving access, to the internet, to infrastructure for broadband. There's a lot of people that are interested in that area. A lot of our members have rural areas, whether they're Democrats or Republicans. So there is a lot of interest. And we do have an infrastructure bill that just doesn't deal with roads and bridges and tunnels and the water system. It deals with the infrastructure around broadband, around healthcare, around education. So if we passed the bill in the House, I know there's a new Congress coming, but if we can get that bill going in the House and the Senate, I think that you'll see some improvements. Telemedicine can be the great equalizer if done properly.
Another dimension of this, and I don't know, I'm not as literate in this element of it as I should, but I know that another thing that just happens, with some communities of color, they're just resource differences, and I'm also very aware that across the nation, most households, if they have a $400 shock of any kind, any crisis, they're underwater. They can't pay their rent. They can't do other sorts of things. So I guess my question to you is, are there things that we need to be thinking more about in terms of reimbursements, or that first dollar being covered by insurance, or what we've been calling carve-outs in high deductible insurance plans, to basically give the diabetes patient some protection in this process so that there's not a cost speed bump to getting care?
Right. Well, I think that we need to look at our whole healthcare system, of course, diabetes very much included. It affects so many people, to see what we can do so, people are not prevented from care because of the high cost of care, or their care, they have the care, but then they don't have anything else. So I think that, there's a number of pieces of legislation and price gouging for Insulin Act, Insulin Access for All, expanding access to diabetes, self-management training act. There's a lot of different bills in the hopper. And the Diabetes Caucus is a bipartisan caucus. I remember when we could go back and forth to Cuba. I went to Cuba with the Diabetes Caucus led by Diane DeGette and Dr. Burgess. And we went to visit where they treated, folks with diabetes. So it's a very much bipartisan caucus because it affects all kinds of people. So I do think that, there's an interest, there's a drive to possibly get some of these pieces of legislation passed that will assist people with diabetes and give them the resources.
What do you think the Kamala Harris, Joe Biden team are going to do on this front when they come into office?
Well, the first thing, they have to deal with COVID, whether that was the plan or not. As we say, they will have to find a way to crush this virus because it's hard to do anything else. If the numbers are like they are right now, they're going in the wrong direction. So they're going to have to look at what we can do with COVID, listen to the docs, listen to the scientists, and also people have to be responsible too. Government can do a lot, but if you don't wear your mask, you don't wash your hands, if you're not physically distant, we don't have as much control over that.
When you also, in the work that you've been doing on telehealth and dealing with CMS, have you found them to be friend or foe in that process?
Well, one thing, they waived during this pandemic, waived some of the rules and regs around telehealth. So I think that's the push that myself and other members of Congress have. If we want to do an evaluation with our bill to see how everything went, what were the pros, what were the cons, if there were, and how can we go forward. Some members of Congress just want to jump to, let's just leave it like this, even though, waive what the rules and regs. And even if when we pass this pandemic, when we get past it, to have an easier playing field for telemedicine. And I know I've spoken to doctors all over this country, and they talk about how patients are keeping their appointments at a better rate. And when I speak to patients, not just diabetes patients, but other patients, it's easier for them. They don't miss work. They don't miss school. They don't have to find a babysitter. They don't have to take 2 buses, a lot of different things. So it's a lot more convenient. I know everything can't be done in that manner, but what can be done, it's a lot more convenient.
I want to ask you one more question before we go to our audience question for you, but and hopefully I'm going to frame this right. I've been kind of trying to dig around on the technologies that are evolving around diabetes, and the monitors, and it's fascinating to look really what's come online in the last few years as potential. And so one of the debates out there, and I guess being a government cynic sometimes, it's my job. Most things government does tend to be driven by inertia, a little bit. Pretty much tomorrow's decided by what they did yesterday. But is there a need to reassess, reimbursements, how, costs are divided, how we think about the cost of healthcare by looking at the outcomes? When you apply new technologies, it may be hard to figure out how to build them or how to get them, done in place, and to kind of look at the fact that, I mean, this is going to seem like a weird metaphor. I used to talk to Senator Dale Bumpers a lot. Senator Dale Bumpers is the guy who got passed the legislation on how you could turn left at a stop sign. And he talked about how much gas that saved each year in the United States. He had the number calculated. And it seems like efficiencies, efficacy, outcomes are perhaps, I have to go back to Marie Aitken to ask, are probably getting a bump up. But I'm wondering whether the system is sensitive enough to those innovations and changes, whether we need to step back, and whether there's the appetite for that kind of discussion among your colleagues.
I think so, because as we know, healthcare is so expensive. And even though we spend a lot of money in the United States, some would say, depending on what we're talking about, we're not number one, in that area. I've done a lot of work around maternal mortality, and the
Right.
amount of women that die each year in a country like the United States is unbelievable. So I do think, we need to take a step back and evaluate what we're doing. What are the outcomes? What can we do differently? Maybe we need to change the script, altogether. So I do think that's healthy to do that, especially since we spend so much money on medicine. And I think that my colleagues would be interested in that.
I really appreciate your mentioning maternal mortality. It's one of those things that haunts me as we do these programs, and I think, particularly in communities of color, it's outrageous. Just call it what it is, and I hope we can have you back to discuss that. But we've got a question from our audience, from Kevin. Kevin?
My question is, what legislation needs to be passed in 2021 that will ensure access and affordability of digital technology for Americans with diabetes and reimbursement to their providers? Thank you.
Thank you. And I should say that's Kevin Donnelly, of the CEO of the PCPI Foundation.
Well, I have legislation, but my legislation does an evaluation on telemedicine, but there's also other legislation, and I don't know it right off the top of my head, I'm sorry to say, that someone else has to just move telehealth aggressively forward, that doctors can start using it more. It's easier to use. It's more reasonable to use. But I can't think of the name of the legislation. I'll see if I can track it down before I hang up, or I can get it back to you guys. But I know there's different pieces of legislation, and actually there's a telehealth or telemedicine caucus.
That's great. Can I just sneak in one more thing from me, as something I talked to Diane DeGette earlier today and to Tom Reed about? Where is diabetes on the priority list of your colleagues?
Where's what, did you say?
Diabetes and those patients, these sorts of issues. I mean, we're talking broadly, generically about healthcare, so I know that's big. But I'm just sort of interested, I asked Diana DeGette and Tom Reed, and they had different answers, really. I said, they both have children that have type 1 diabetes. And so for them, you can feel, actually, and I've talked to them before, incredible tension and incredible commitment and passion on this. Not everyone has those same experiences. And so I guess my question is, you're a legislator, you have issues with maternal mortality, I feel like you do. What's the literacy? What's the empathy? What's the priority of this kind of issue among your colleagues?
I think, it depends who the colleague is. If you sit down with CBC members, I think you will find more empathy, just because of the rate of African Americans that have diabetes, someone's, grandmother or daughter, or someone in their family, or, a close friend. So people have had those experiences. And I think, maybe if you didn't have the experience, or you don't know anyone, and there's so many issues, that we deal with, maybe you don't think about it as much. But I think when there is education and awareness, I think that, there is empathy. And when people know struggles that people have to deal with diabetes, I think that people would be empathetic and want to do something about it.
Well, Congresswoman Robin Kelly, I've really enjoyed this conversation. I think we've opened up a lot of doors we could come back and talk about. Thank you for your work in the Congressional Black Caucus Health Braintrust, but also the Energy and Commerce Committee, one of my favorite committees to watch on the Hill. So thank you so much. Thanks for joining us today.
Okay, bye-bye.
That brings us to the end of our program today. A big thank you to Eli Lilly for their support, and to all of you attendees for joining us for this set of very important discussions. For those of you who missed any of the conversations, we'll have a video up from the event on our website shortly. I'm Steve Clemens. Be well.